in an earlier version of the agenda, the session was called a call to action. Then I got a little bit nervous that we were being ambitious, and so I said, let's rename it to Next Steps. But I'm going to challenge us to be ambitious and really to think about, I think we started the day with outlining why we're here, which is really to try and pull from all these various different perspectives to understand what it is that we can do to create resilient health systems. So not just what are they, but how can we work to create them? And so I really do want to spend some time thinking through what are practical next steps, what is the call to action on the concrete actions that we can take. So just to frame that, I've got a couple that we identified in sort of the Office of Health Systems that we hoped would come out, which I think have. And then a couple, I've sort of gone through each session that we had today and just sort of picked out one action item that I heard, which I will give. And so forgive me if I don't do justice to the sessions. I only picked out one from each one. And then I'm going to open it up and have those of you who are so inclined offer up what you think your next steps are. So start thinking about that now. So I want to, I think first of all, there's sort of three main actions related to resilience that under which I think we can categorize our next steps. That is One Health System, the concept of self-regulation, both in terms of sharing and communicating information and being able to respond, and then self-reliance, which really, I think in this context, is about being able to support further development. It is not just self-sustainability, I think, as was mentioned, but really how can we continually improve. On the One Health piece, so I'm glad that our colleagues from DAI brought up One Health in the last session. I had the pleasure of speaking at their end of project event last week on the global health security agenda, and I sort of shamelessly stole this from the end of that session, where one of the concluding things that we came up with was there are these One Health platforms that work across human and animal to prevent diseases. But really, when we're thinking about resilience, One Health and the definition of that should be expanded to include, I think, as was very nicely said by Professor Links, One Health in terms of how do all the sectors work together to promote health? How does both civil society and private sector and the public sector work together? So One Health really being very inclusive of everything that it takes to work together. And so we had identified that we want to make sure going forward that we're working to improve linkages between communities, civil societies, health systems, and other authorities to prevent, respond, and recover from existing and emerging crises. And we think that includes providing incentives for the private sector to take a greater role in health systems resilience and to work on designing new governance structures to help manage and coordinate these linkages. I think slightly more at the donor and partner level, we want to be very deliberate about promoting partnership between multilateral and bilateral development agencies, as well as private foundations, academia, basically everyone who's here today. We need to work together more and not just have meetings like this, but really be very deliberate in those interactions. Under self-regulation, we want to, as I said this morning, is one of the things that we're thinking about is how can we foster some of this culture change so that we're getting to a culture within health leaders in countries of safety, equality, learning from mistakes, making evidence-based and informed decisions, and then really truly owning the accountability for the performance of the health system. And then how can we strengthen, or we want to, sorry, I'm being action-oriented, not provocative. We want to strengthen the communication in times of crisis among communities, health systems, and other structures. And then continue to share this kind of learning and information. I know there will be a report written by Measure Evaluation, and on that note, I also was remiss this morning in not thanking Measure Evaluation for all the support that they provided to setting this up today, and we really look forward to their synthesis of this very important discussion and topic to really help us provide some of that pathway for the way forward. On self-reliance, we do think there's a need to explore financing mechanisms to really get resilience to emerge. and to, I think as the last session highlighted, really think through how we can reform and strengthen the information systems that contribute to this. So those are some of the ideas that the Office of Health Systems thought about before the meeting, and then just a couple that I pulled out from each session. So the first session, which again, we had a representative from the State Department, from, now I'm not going to remember it all. Yes, shocks to the system. So we had WHO, State Department, and our colleague from the Democratic Republic of Congo. The one thing that I came out was there was a call to action for assigning roles for coordination. And really, I think we can look at, as part of this One Health approach in the very expanded view, how do we assign individual roles so that coordination happens on a more regular basis? In session 2, where we had representatives from USAID, the World Bank, and the Gates Foundation, I think we really talked about this issue of culture, which I think fits under the self-regulation theme, and that the need to engage citizens early and tailor our communications to the community context. So how do we change some of that culture through very deliberate and specific communications, and really taking up the mantle to try and do that. In the third session, where we really heard from our civil society and private sector partners, one of the things that came up was this idea of redundancy, and how can we make the redundancies deliberate? Sorry, I have to speak more action-oriented. Let's make the redundancies more deliberate. So not look at them as duplication, but deliberately, where is their redundancy? So in the event of a shock or crisis, one can pick up from the other one. Session 4, on the multi-sectoral approach, I really think we picked up on this redundancy idea and added an aspect to it in terms of layering. Can we be deliberate about how we layer? So we want to work with other sectors, but it's not necessarily, I think, again, as Dr. Link said, it's not just 10 sectors with 10 approaches to one problem, but it's 10 sectors with one approach to the problem. But that approach has different layers, as articulated by Christine. How can we layer in each of the different, or we need to layer in each of the different sectors and what their comparative advantage is. And then finally, I just, from the last session, I really think it's important to remember this concept that resilience starts when there's a failure, and what we're trying to do is shape the recovery. And so we want, ideally, there aren't failures, and I think from a health systems perspective, there are some of these more everyday expected failures that we can hopefully get to a place where we stop from happening. But we're never going to really know how resilient our systems are until there is a failure, and then how quickly they can recover. So with those sort of initial ideas, I am turning it over to you all in the audience. So raise your hand and we'll get you a mic. If there is an action item that you will do personally, or you think we should all do together to promote resiliency in our health system strengthening work. There's one down here in the front.
I think it's an excellent list. I just like to comment on one issue. So redundancy is one way of achieving resilience, but you shouldn't focus on redundancy, because basically the idea is that you need to make, you need to have ability to do a thing with different ways. It may be the same, you can have two generators, but maybe generator and flashlight. It will be richer. So I would not talk about redundancy, but rather use some other words.
Okay, well, so you have to come up with the action. You can't,
okay.
You can't make a comment. You have to have an action.
Okay, I will think about
No, 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 no. You can't put down the mic. Made you go. You see, this is your punishment for going first.
Find alternative way to achieving critical functions.
Great.
And the other thing I like to commend, this kind of normal failure, we call it reliability, because resilience is really when you get kind of unknown big events. Reliability when you have system fluctuating around kind of normal behavior, but of course you go ups and downs and you know how to solve them.
Great, thank you. I will make you have an action.
I may have misheard, but I just would like to emphasize that I think resilience needs to start before there is a shock, before there is a failure of the system. Just building on some of Margaret and others' comments throughout the day on the need for the engagement long before there's a crisis.
And so the action, you have to have an action. Or some sort of, something concrete
That we are
to
looking
build
at,
resilience before.
we are looking at strengthening the capacities, whether they're adaptive, transformative, that we're looking at the systems before there is a shock to the system. You're planning for the shock.
Plan for shocks, great. In the back.
Hi, I'm Lara from Pathfinder. So I think building on that comment about how you plan for shocks, I'm really struck by this idea of the kind of everyday shocks. And I remember when I was living in Accra, Ghana for many, many years, there would be a cholera epidemic, and everybody responded like, shock, epidemic. But there was actually cholera epidemics every single year, so it was actually very predictable. So the action is to take some of the countries in which we work and analyze the data for several years prior and say which one of these things are actually recurrent, everyday shocks that we should have been thinking about and planning for. Thanks. Snow in DC. Yeah, like, thank you, snow in DC. Thank you, exactly. Thank you.
Well, and I think we talked this morning a little bit too about this concept of iterating and improving. And so if something like that happens, we should be looking at after action reviews or how can we do it better next time. Another action or thought? Oh,
Hi, this is Nadia Olson from JSI. In terms of supply chain strengthening, there are some concepts that we've adapted from the commercial sector that relate to redundancy and what we've coined segmentation, where you think about those diagrams, the wiring diagrams. I don't know if you all are familiar, where you have like 1,000 supply chains in one country and they're parallel, and we've talked about how important it is to integrate those supply chains. But this is a way of thinking about smart integration and building sort of backup systems or different streams, but thoughtfully, that intentional redundancy that we were talking about, so that you have a responsive, resilient system. So we will share that, and I think it can be extended beyond just the supply chain. I think it applies to health system design, not only the supply chain.
great, thank you for that. That's wonderful. Over here.
Hi, I'm Ochi Ibe, ICF, IDDS, and I'm coming at it from the perspective of someone who is very community-oriented. And so I'm saying that we should continue the multi-sectorality, because at the community level, all the sectors interplay, and if we're looking at things from the community's perspective, the importance of working in a multi-sectoral manner, you know, kind of is obvious, and so we need to continue to do that in terms of multi-sectorality. Thank you.
So multi-sectoriality from the community's perspective. Great. Eric.
Okay, action item. I think I encourage all of us to look at our way to absorb, help systems prepare, absorb, recover, adapt by having a lens of evaluation on the systems that's larger than the sum of the part of our project. Project by project, we might not be able to do so much for resilience, but if we learn to take a step back together and take the lens of the system, we might be able to work with our partners and understand the risks that are coming ahead better.
Thank you, and I will put in a shameless plug for the Office of Health Systems Monitoring, Evaluation, and Learning Guide, also done in partnership with Measure Evaluation, which looks at ways that we can monitor and evaluate system-wide effects in regular projects that get to that. So methodologies in Chapter 6. Look it up. There's one back here.
Hi, I'm Amanda with USAID. So as we're having this discussion, I was really excited for this event. I keep thinking about climate risk management and what we do in our programs now. And something that keeps coming to mind is that we go through this exercise where we think about all the impacts that a changing climate or variability may have on our programs at the activity level or at a larger programmatic level. And I'm wondering, like, if we have any thoughts of how we take that to the next step of just taking it from a check-the-box exercise to actually implementing that in our programs and monitoring that. So if there are any thoughts, it's not an action item. Thanks.
It's an action item to think about how to implement climate risk management more deliberately. One over here.
Thanks, Kelly, for the summary. From a practical point of view, I am trying to imagine the approaches or solutions will be quite different in countries like Brazil or countries like South Sudan or Yemen. How do we contextualize our recommendations so that we are practical, we can provide practical guidelines to our country offices and to the government counterpart and the other organizations? Thank you.
Great. I think that's another important point. We need to contextualize recommendations because a lot of times people gloss over them when they think it's sort of one size fits all. And the discussion today has been very rich about the importance of context in different areas. Any other actions? Vince? Down here in front. Oh, in the back, and then over here.
Thank you, Nefervaltis, USAID. So one action item that comes to mind for me relates to how can we as donors and implementing partners, for example, avoid missed opportunities in the way that we do business just day to day? What could a couple of low-hanging fruit, but perhaps less sexy, but nonetheless worthy action items be? One that comes to mind is that in Global Health Bureau, we have a country support team structure, and we might consider requiring through our development assistance mechanisms those whom we send out for technical assistance to missions to complete the tabletop exercise training so that they're aware of how our humanitarian assistance arms of our agency functions, because sometimes understanding what opportunities could be and missing those opportunities are a consequence of not understanding the roles and responsibilities of someone else. From the other direction, I think we need to ensure when we send out disaster assistance response teams that those newly assigned DART members are receiving a rigorous introduction or orientation to the health system when they're deployed to a country. Because having just come from a month in DRC, what we found is that certain response teams from different agencies don't understand the local context and the health system, and so they're not able to identify opportunities to integrate, for example, health emergency preparedness plans into already existing plans, and they're creating additional burdens for health administrators. Thank you.
Great, thanks. Yeah, so I'm really pleased with the turnout today and all the tweets, but there's more we can do to spread the word and make sure everyone adopts these ideas and approaches.
Great, thank you, Kelly. Rashna Ravji, Global Health Bureau, Office of Country Support, USAID. Now, it was a very interesting discussion, and I was very much impressed by the model, the nationalistic model in the health extension workers in Ethiopia, that the model which started as a grassroots and became part of the government system. And that shows that, in a way, the government changed the culture, or is changing the culture, and working with the community health system and private sectors to be able to establish a resilient system. So my action point is like educating the governments and building capacity of the public sector to embrace the private sector. That's a constant, even what Robert Clay said, 37 years before we were talking about community health, and now we're talking about community. What did not work, or what worked, you know? I think some of the changing the mindset and the culture and educating the government, the public sector, to embrace the private sector, working jointly as partners towards building a resilient health system. And I think it's a broad action idea, but the whole idea is to change the people at the top, the way they think, and how we can help the grassroots come together to be able to make
I think that's great. And you know, one of the other themes that came out, I think, in several sessions that I just couldn't quite figure out how to turn into an action item was this whole concept of trust. I think it's trust of, you know, the trust of the private sector by the public sector, trust, I think we heard in the first session, of law enforcement communities and sort of those sharing between health and law enforcement, trust with civil society and the public sector, and with communities and health workers, and really a lot of resilience. I think it came up time and time again, hangs on trust. I'm going to go over here and then back there.
Hi, Vince Blazer, InterHealth and the Frontline Health Workers Coalition. Thanks for this today. And as I was listening to all of the recommendations, it just occurred to me that many of them, whether it be planning for shocks or the intersectoriality things, create, to do those, you need money, time, space, legal mechanisms, or policies to allow that to happen. And I was just thinking about kind of the flu preparedness domestically, the mechanisms that were needed to start creating those things. And so I would say that most people here may not see themselves as advocates, but they really need to, what the messages that were here need to be heard, and not just by health ministries, but by all of these other ministries, and as well as legislatures as well.
Great, thanks. Everyone should be an advocate. In the back.
Sure. My name is Pooja Shripad from Population Council, and I agree the conversations about trust are really interesting, and it's something that I've spent quite a bit of time looking at qualitatively. And I think Margaret's point and a few others' points around it needs to be developed and built at an earlier stage than before any shock hits, and then thinking through how, and actually observing and asking people about how that changes over time is really important. And I think my action item is thinking a little bit more about the community health space, and thinking about community health workers and frontline health workers as the initial entry point to the health system more broadly, and to actually begin to develop or think through the development of some measures for trust at the community health worker level.
Yes, somebody said you can't have a resilient system without a resilient worker, which I think is definitely true. Somebody else have the mic? One more? That's fine. It's behind you.
Just in relation to the question in the back about climate change, and remembering Dana's comments in the morning about system design and thinking about the systems of the future. Although it's true some designs are different for Yemen or Sudan, I think something we learned a lot in the LAC region when we had a regional initiative is that we learned a lot from the middle-income countries, a country like Chile who's gone through a health reform and a e-government reform process that happens well beyond the health system. It happens in departments of treasury, and we had a lot of opportunity to exchange between poorer countries like Nicaragua, who you would never imagine would be homologous to a Chile, but they were in some ways, and were able to support each other. And these models, I think, that some of these middle-income countries have developed are more applicable because it's more recent in history that they have developed those systems, and it's in the context of climate change that they're carrying out those reforms. Like Chile's very good at responding to earthquakes, and we can learn more from them, and in fact they know more than any of us here in this room about that, but they aren't necessarily the experts that we're engaging to provide that technical assistance. But I've learned the most from them than anyone else when I provide technical assistance.
Great, thanks. Multi-directional learning, I think, is a key action item that we should all take. All right, if there's no further, you have then extra time to network amongst yourselves and continue the conversation. I do encourage, if you haven't had a chance yet, to take a look at the timeline. It's really fascinating to see what people put up. So just, walk by and take a look. And, with that, I just want to thank everyone again for your active participation today. I want to thank all the panelists, all the moderators. You did a great job and really helped us sort of move this conversation forward. And we really look forward to continuing the conversation and implementing some of these action steps.